Hello, everyone, and welcome. My name is Staff Sergeant Dozier, and on today's episode, you'll be joining me as I interview a United States Army physical therapist. This is Tell Your Army Story. Welcome back to Tell Your Army Story, and today I have the honor of speaking with United States Army physical therapist Captain Andrew Toman. Thanks for stopping by today, sir.
Thanks for having me.
No problem, sir. I just want to thank you for squeezing me into your busy schedule. Aspiring physical therapists around the country will benefit greatly from hearing what you have to tell us today. So we'll start with our first question. Where did you go to obtain your doctorates in physical therapy? And how was your experiences after graduation?
So I attended the University of St. Augustine for Health Sciences at the Austin campus, and I graduated in 2017. It's an accelerated program, so it's pretty demanding. But throughout the whole time, I wanted to meet with a recruiter. I didn't have the chance to work with an Army recruiter then that much, but once I graduated and got started like in civilian side, that's when I reached back out and wanted to keep going. But the program that I went to, it's a private school, so it's a little bit more expensive, but it definitely gave me a lot of the skills that I needed to be successful, both as a civilian, and I even use those skills to this day.
Nice. So after completing physical therapy school, how was life immediately following?
I immediately immersed myself into an outpatient orthopedic clinic just because I wanted to get my orthopedic clinical specialist. So I had to get a lot of hours for that. I was working in Tampa, Florida. Had a great opportunity to work there. That's where I reached out to the recruiter and pursued the opportunities there. But it wasn't a super immediate process. It was definitely, hey, I had to graduate, get my feet wet, learn my job, and then I wanted to bounce forward.
So, sir, what ultimately pushed you to seek out a United States Army medical recruiter?
I'd always wanted to use my skill sets to serve our soldiers and our nation. I never felt like I had that until the training was complete, until I got my licensing and was like a seasoned clinician, so to speak. Um, but then since I had talked to recruiters on and off throughout school, I wasn't sure on the timeline. I had to make sure that I could have a job and feed my family immediately after school because it was private school, so I had to get after those loans right away. But I just got bored in the outpatient setting and I wanted to do more. So the reaching out to an Army recruiter was what helped me get a better understanding of the timeline and how to actually join the United States Army and you put my skills to the test.
So, after reaching out to the recruiter and completing the application process to finally get selected, what incentives did you receive once you put on the uniform?
So at the time when I came in, the main one that they had was the Health Professions Loan Repayment Program, which is one that, and I used it and I was able to get in it and receive the benefits of. It was about $120,000 towards my student loans, which is a substantial amount. It is taxed, but it's way more than I could ever pay off on my own in
Right.
the time frame that it was, and the commitment to the Army with that was very reasonable.
Wow, knowing that the Army has available to you a loan repayment program that will pay up to $120,000 of your student loans if you decide to serve actively, or pay up to $250,000 of your student loans if you decide to serve in reserves, is an amazing opportunity that no one, especially those who took out student loans, should ever pass up. So, sir, once you sign your contract, you're fully commissioned into the United States Army. What happens next?
But that's when it was about getting scheduled into direct commissioning course and BOLIC, which is Basic Officers Leader course for AMED, so medical specifically. From my commissioning to shipping out to going to the direct commissioning course, it was about 2 weeks. So it was a pretty quick turnaround where they send you up to mine was a 5 week course. I think it's still about the same timeline up at Fort Sill in Lawton, Oklahoma, where you learn all the basics like how to march, how to shoot, how to do land navigation, uh, rank structure, a lot of those different things. I mean, I also through that process, made a ton of lifelong friends, from social workers to occupational therapists, dentists, nurses, uh, audiologists, anything in between in the medical world. I made a lot of connections, as well as with a lot of physician's assistants that I talk to this day. And then once you complete that course, then you're able to attend basic officer leader course, which you need to go to before your first duty station. And human resources command, when you get your orders, that's all in there, right? You do those courses for back to back, and then you show up to your first duty station. But basic officers leaders course was like the next step, right? Really developing me as a leader, as an Army officer, understanding the nuances of how Army structure works more than just the basics, and then especially as it relates to medical, where it's a long course. Still working with a lot of those friends that I had because our courses lined up the same way, but even getting exposure to field training problems where we learn more about like what a field hospital would look like, mass casualty situations and how to navigate those, and working the different roles from medics to dentists and everywhere else in between. So it was another great experience that I got.
So after DCC or the direct commissioning course and bowling, the basic officer leaders course, you're ready to take on your first role as a United States Army physical therapist. How was your time as a military provider?
It's been really good. It's been fast paced. I got to my first duty station at Fort Cavazos in Fort Hood, Texas. Well, formerly known as Fort Hood, with First Cavalry Division, where I then deployed, and I got to go see part of Europe, right, taking care of our soldiers there across the European continent with NATO partners, which was an amazing experience. I'm currently at Fort Liberty, North Carolina, with the Second Security Force Assistance Brigade, where our area of operations is in Africa. So I've also had the opportunity to go and take care of our advisors there in that continent, which has been an amazing experience. Um, in addition to that, my caseload has been very manageable in the sense of being able to provide the right kind of care for the right soldier at the right time, right?
Yeah.
I do have a non-commissioned officer who's the equivalent of a PTA, so a physician or a physical therapy assistant, who helps me carry out the caseload, which is really, really amazing to have that partnership and have a manageable caseload to really just do what I joined to do, which is take care of the soldiers.
So now that you have the uniform on, sir, what opportunities are available to you to continue to grow as a physical therapist?
Army provides a lot of different opportunities. The main one that is available for physical therapists specifically is the Colonel Douglas Kersey course, which is a 1 to 2 week course for advanced training, for postgraduate training, with when it goes from as far flung as diagnostic imaging to therapeutic exercise, modalities, other interventions, as well as even learning a little bit more of how to work those relationships with other doctors, physicians assistants, and other personnel that you might need help with. That's one main course that I've done. I've been able to get battlefield acupuncture credentialing, trigger point dry needling credentialing, and even point of care ultrasound, so that I can provide that care for my soldiers.
Wow, sir, what an amazing opportunity. So, last question. In your honest opinion, what is the main difference between a United States Army physical therapist and a civilian physical therapist?
The main difference is that I get to provide the care to the full scope of practice that I've been trained to do. So on the civilian sector, we all still obey the practice guidelines. So we follow what we're trained to do. In the civilian side, though, but depending on state that you work in, you might have certain restrictions. So some states still don't have direct access. Some of them do not allow physical therapists to refer for imaging, or even do dry needling. In the Army, you are the front of that. And then on top of that, I'm not concerned about insurance reimbursements, right? I'm not here worried about how many appointments is this soldier available to attend. I'm just going to do the right thing for them. If they need to come in twice a week or 3 times a week, that's what they do. If they need to come in once every other month, that's what they do, and we're not worried about that. So that's the main um, differences that I see between civilian and military.
Awesome, sir. Well, I appreciate you taking the time today to answer the question that I had, and I know others watching this video will benefit greatly from what you had to tell us today.
Thanks for having me.
No, sir, thank you again for stopping by and telling us your Army experience. My name is Staff Sergeant Dozier, and we will see you next time on Tell Your Army Story.